support to mothers who are interested in breastfeeding. Identifying birth defects, we have the newborn screenings that are required. We also have a neonatal abstinence syndrome project that is actually through our neonatal division within MSPQC. So the neonatal teams work on a NAS project within the hospitals. And so Golden Hour, the next project that you see on there, that's also a project. It was actually one of our first MSPQC projects. And the Golden Hour looks at the first hour of life of a baby and looking at what really happens to that the baby in the first hour of life. And so that project has been going on for several years. It's actually in maintenance. So the hospitals really are collecting data on the Golden Hour project. And the hospital data is kept within that facility. Again, as I mentioned before, the hospitals get to look at their own data to see how they are doing, what improvements need to be made. We also have a fetal infant mortality review on the coast of Mississippi. We have what's called a femur nurse, and the femur nurse coordinates infant mortality reviews in that specific area on the coast. It's 9 coastal counties. And then also there is a community component to femur, where after the cases have been reviewed, looking at those issues that prevention programs, that could be implemented into the community. The femur program on the coast has been going on since 2012, and we have a wonderful nurse on the coast who has really established some very good relationships with the hospitals, with the clinics, with the physicians in that area to really promote, safe sleep. And she has a host of topics for her community action team meetings. And so it really helps bridge the connection between clinical and community. And then also last, I wanted to mention the perinatal periods of risk analysis and community level interventions. So that is another one of our strategies as well to prevent poor maternal and infant outcomes. Next slide. Oh, and before I move on, there's also a link to our maternal mortality report that has more information on the strategies as well. And that is also at the bottom of this slide. Next slide. And the last thing I want to mention, as far as our community efforts, the Maternal and Infant Health Bureau just released a community request for a proposal, or an RFP. The title is Improving Maternal and Infant Health Community Project. And so the purpose of this RFP is to support community-based organizations and their efforts to reduce maternal morbidity, mortality, and infant mortality. So there are certain things within the RFP that the organization must respond to be eligible. The types of organizations that may apply, again, is community-based organizations, FQHCs, anybody that's working in the community that has an interest in helping spread the message or implement this project. The full announcement is located on our MSDH website under RFP and grant section. The announcement of the RFP was released on July 9th, and the application deadline is August 9th. So there are more details about the eligibility requirements and things of that nature. So you can go there for more information. And I think that is my last slide. I think Jillian is up next.
Thank you, Monica. And Jillian is going to talk about our exciting opportunity for growth and transition. So take it away, Jillian.
Good morning, everyone, and I am excited indeed. Our new program, our revamped program, is called Healthy Moms, Healthy Babies of Mississippi. It is a maternal and infant support program. Next slide. So Healthy Moms, Healthy Babies of Mississippi is a support program for pregnant women and their babies less than 1 year old. This program partners with patients, communities, and medical providers to provide enhanced access to healthcare, nutritional and psychosocial support, home visits, and health education. And we're excited about our revamping of the Premise program, which I'll talk about that in a little bit. But this has an opportunity for us to increase our engagement with the community, as well as making sure that we're providing patient-centered care, really connecting with our medical providers and our community partners so that we can increase change. Just like Monica and Lauren was showing our numbers and some of the things that we're trying to do. So with this program, we're really hoping to pave the way into our purpose. So our purpose is, the purpose of Healthy Moms, Healthy Babies of Mississippi is to provide patient-centered and equitable services to support healthy births and help reduce maternal and infant mortality rates in Mississippi. And so we saw what those rates are looking like now and in the past years. So we're really, really pushing to improve those efforts to reduce those rates. And so our program is for all expectant moms of reproductive age, as well as the babies of less than 1 year of age. And next slide, please. So I know you all are wondering about Premise, our case management program. So we've changed it, of course, to the Healthy Moms, Healthy Babies in Mississippi program, formerly known as Premise. Also provides a multidisciplinary support team to assist moms and babies who have identified health risks. The Healthy Mothers, Healthy Babies in Mississippi team may help with finding a medical home for mom and or her baby. So sometimes we have referrals to where our expectant moms haven't found a provider yet. So we help them with providing that, as well as for babies who don't have a pediatrician or other services. Identifying family and community supports. So sometimes our moms and babies really don't know who they can count on as far as having that support team. Of course, our program helps with that. And also we help them identify who in their family or who in the community can help them just navigate their pregnancy as well as being a parent. Referrals for services such as Medicaid, food stamps, SNAP, and WIC. Referrals for family planning, mental health, transportation, housing, medical services, childcare, employment services, and breastfeeding assistance. So we're there. We really want to connect with our providers. As far as the psychosocial needs, as well as their community needs, to be able to assist them and navigate that aspect of it. We know that sometimes pregnancy can be a stressful time, as also as being a parent. So we want to help them to be able to navigate that better. Also, we provide postpartum home visits. And so those postpartum home visits help in reducing the maternal morbidity or maternal mortality, as well as infant mortality. One of the big things we discuss is safe sleep. And, you know, we go over basic parenting skills and also discuss those post-birth warning signs that Monica mentioned earlier. We also provide health education, such as preparing for the hospital, urgent maternal warning signs, depression, anxiety, caring for baby, infant safety, healthy infant development, and of course, nutritional information. Next slide, please. So funding for Healthy Moms, Healthy Babies of Mississippi. So previously we were receiving Medicaid funds, and of course we still receive Medicaid funds, but we're also open to not only our moms and babies that are on Medicaid. We do receive referrals for other moms and babies who may not qualify. So Medicaid beneficiaries are eligible to participate in the Healthy Moms, Healthy Babies multidisciplinary support program when a provider identifies one or more health concerns or barriers to care on a screening assessment. Referrals can also be received from community partners, agencies, or self-referrals. So if you've had some health issues or baby's had some health issues and you think this would be a great program for you, you can refer yourself. You may know a cousin or sister who can benefit from this program, or a recipient of whatever services that you may provide. So it's not just for doctors to refer, but we also accept those referrals in the community. So we're very excited about the changes that are going on. Again, it's formally premise. So if you've been sending referrals to premise, continue to send those referrals. You will get something soon about the changes with Healthy Moms, Healthy Babies of Mississippi. Back to you, Dr. Dobbs. Oh, I think I have my contact information. Sorry about that. All right, so for more information about Healthy Moms, Healthy Babies in Mississippi, you can contact myself, Jillian Harper Peavey. I have my phone number down there, as well as my email address. So we're very excited. If you would like to partner with us, please give us a call or email us. We're more than happy to welcome your partnership, as well as receive those referrals, so we continue in the fight of helping our moms and our babies be healthy. Thank you.
Outstanding. Thank you so much, Jillian. And if we can go ahead and stop sharing, that'd be great. Sharing the slides, and we can just see each other. We can go to gallery view. Thank you. That'd be fantastic. One of the things I just want to reiterate, or just really make apparent, is if you look at a lot of the risk factors that we see for infant and maternal death or morbidity, a lot of the things are within categories that are preventable. Some of the stuff really is not, but a lot of it is, and that's where we really need to focus. There are opportunities for us to make Mississippi a healthier place for moms and babies. One of the things that I didn't do that I want to go ahead and do now, Bailey Anderson did introduce herself, and we're super excited to have her. I also want to let Dr. Case Hagan introduce herself and let us know a little bit about her, so you can get to know her, and then I'll let Monica and Jillian also introduce themselves. Dr. Case Hagan, tell us about yourself real quickly.
Sure. My name is Lauren Case Hagan. I'm a Centers for Disease Control and Prevention epidemiologist. I was assigned to the Mississippi State Department of Health in October 2020. And so I'm relatively new to Mississippi, but not really new, since my grandparents lived in the Hattiesburg area. So I'm happy to be here. I'll be working a lot with the maternal and infant health, and kind of the broader sections that support women, children, and families throughout the health department. And I'm really excited to be here. Thanks.
And I'll kick it over to Monica to introduce yourself. Monica.
Good morning, everyone. My name is Monica Stinson. I am the Bureau Director for Maternal and Infant Health. I've been in this position since 2014, working alongside Dr. Collier, and our team has grown very much so since 2014. I think it started off, it was just Dr. Collier and I. It was a two-man show, but we are excited about the growth of the Bureau and how we work so closely with all other programs in the health department and maternal child health and community organizations. And there was just so many things that I didn't get a chance to mention on the presentation, but we do work alongside a lot of community-based organizations who are doing great work. And so I'm just happy to be here, and thank you for allowing me to be on this panel.
Thank you, Monica. And Jillian, why don't you introduce yourself?
Good morning again, everyone. Again, my name is Jillian Harper Peavey, and I am the Director of Healthy Moms, Healthy Babies of Mississippi. So glad to be here. I am a social worker by trade. I am passionate about helping moms and babies to succeed and to grow and to develop, especially for babies to go forth and be great, and hopefully be in your preschool classes and your elementary schools, and go forth to do the same work that we're doing right now. So it is a pleasure. Again, we have revamped Premise. Premise has been around for about 30 years, a little over 30 years. And so we're looking for a change so that we can better assist in the fight of reducing infant mortality, maternal mortality, and infant morbidity and maternal morbidity. So again, thank you all for having me today.
Thank you, Jillian. And then while we have him here, not that I'm going to put him on the spot or anything, I do want Dr. Edney to introduce himself. He's our new Chief Medical Officer. So just say hello to everybody. If you can. He's waving that. Dr. Edney,
Hey,
off
there
to
we
you.
go. Hey, good morning, everybody. I'm Dan Edney, proud to be the Chief Medical Officer for the agency.
Great. Thank you, Dr. Edney. Well, I'll just go ahead and say, what we want to do, we want to make sure that we are capable of targeting women and babies who need our help. We want to make sure that we implement an evidence-based program, under which we are in a evolutionary process to bring forth evidence-based interventions that we know work. And for you guys who are out there working with moms and babies, we want to be a resource to you guys so that if you have a mom who needs some extra help, if you have a baby who you're worried about and need somebody to check on, we're not really going to be at home health. We're not going to be able to help people with tube feeding and that sort of thing. But what we can do is we can help sort of address those barriers that exist because of the pre-existing social determinants of health, making sure people have access to resources, working on transportation, making sure that folks know how to take care of their babies, doing home visits to make sure that we do everything we can to prevent SIDS or rollover deaths or other things that are totally preventable. So stay tuned. We'll get more information. We'll plan to also have this information available on our YouTube channel as well as other distribution mechanisms. But I'll go ahead and open up the chat function for questions. So if y'all want to ask questions, please let me know. I'm gonna read one right here. I have one from Anita Henderson, and the question is: how many moms and babies are currently in the PHRM, or we're going to call it Healthy Moms, Healthy Babies program, and what percentage of Medicaid moms utilize this program? I will go ahead and kick that over to Jillian. She's going to be more knowledgeable. We don't have that many babies and moms enrolled right now. Part of that's an outcome of the pandemic, and part of it's our growth process. So Jillian, why don't you go ahead and tell us?
So that is a good question, Dr. Henderson, and we appreciate that. So we have around 500 right now. That includes moms and babies enrolled in premise. And like Dr. Dobbs was saying, in the previous years, it's been a lot more, but due to the pandemic and Mississippi State Department of Health fight in the pandemic, as well as others, our rates have decreased a little bit, as well as because of the fact that we are changing our program and making it better so we can better serve our Mississippians. I do not have the data on hand of what percentage of Medicaid moms utilize this program. Lauren, I don't know if you have that on hand either right now.
But it'd be a small percentage if you just do the, just think about it. 500 is just a very small percentage.
Yeah, with over 60% being on Medicaid, that 500 is, and it's, that's a very small percentage. But I believe we're also not the only entity that now is able to implement premise.
Other questions that you guys might have for us? We also, we want to hear from you of what you guys need out there, what sort of deficits you're seeing for your patients and their families. What can we do to sort of help bridge those gaps? So, you can tell us now, or you can feel free to email me or Jillian. Jillian, would you mind putting your email in the chat one more time so people can, so if y'all have comments or if y'all have questions or if you have ideas about how we can better serve the residents of Mississippi, please let us know, because a lot of you guys are on the front lines. You're seeing the challenges that your patients are facing. We know what a lot of them are already, of course, but there are probably some that we're not familiar with that we could help with. And if we don't have any other questions, I just want to say thank you all for your time. Expect to see more. This is going to be a priority for the agency, making sure that we do everything we can to fight infant mortality, maternal mortality and morbidity, and promote healthy babies, healthy moms, and healthy families. Thank you for your support. More information to come, and we're going to be able to give you guys about 15 minutes back in your morning. We know that everybody's busy. So thank y'all. And I want to thank you all for the opportunity to talk about something besides COVID. I need a COVID vacation. We all do. All right. We'll go ahead and close it here now. I thank you, everyone, and to the MSCH team. Thank you all for great work. We got a lot of great work to do. And Bailey Anderson, Miss Mississippi USA, thank you again for joining us and for taking on the advocacy for this important issue.